A last-minute decision means no new mask mandates in LA County. Public health officials say it's not the right time to renew indoor restrictions. And here's why. The county reported 7,000 new cases today. That's down from nearly 8,700 last Thursday. Hospitalizations are also down about 100 from a week ago. But did politics play into this decision? Well, KCAL9 political reporter Tom Wade is here with some answers. Tom?
Hi, Pat. Well, the county's health department and health director, Barbara Ferrer, was asked directly whether politics played a role, as you said. She said no. She says she just followed the science and the numbers.
This is a big relief. Now I can go on to worrying about the things I usually worry about.
Jennifer Ferrer is the owner of McLeod Ale Brewing Company, a restaurant in Van Nuys.
Any kind of COVID things affect sales. There's no question about it. And mandates absolutely do.
The announcement not to reimpose an indoor mask mandate came at Thursday's planned weekly briefing.
I think given the data that I shared today, it's a sensible place for us to be to not go ahead at this point and implement that universal indoor masking.
LA County Health Director Dr. Barbara Ferrer citing declining hospitalizations and infection rates in line with the CDC guidance as the major factors in the decision not to impose a masking mandate. And she said pressure from 2 county supervisors and some members of the business community and general public did not impact her decision.
It would be a little bit ridiculous to, go ahead tomorrow and implement universal indoor masking if I know that a few days from now we're going to be moved back to medium.
We asked longtime former LA County supervisor and professor at the UCLA Luskin School, Zoltanovsky, if he thinks opposition from the supervisors and some in the general public played into the decision.
I think that had some influence over it, and I think, frankly, the downturn in the number of incidents of infections of COVID over the last few days, maybe the last week, also had probably a bigger influence on Barbara Ferrer's decision. Barbara Ferrer is a scientist. She goes by the book, and I know that many of the decisions she's made have been controversial. The longer the COVID has gone on, the more controversial her decisions have become. But she has only one interest. Her interest is our public health.
Dr. Michael Daniel works in the emergency room at Providence St. Joseph Medical Center.
One lesson learned from this whole debate about whether we needed the indoor mask mandate is that we need better data. It's something that I've been advocating for since this past winter with Omicron, is that we need some more specific data on the hospitalizations, like who is there for COVID, with COVID, who's requiring ICU level of care, and then a breakdown like vaccinated, unvaccinated. And I think when you show the public and are much more upfront with that data in particularly.
And a reminder, as for masking, the science says they work for slowing and stopping the spread of COVID.
The important distinction that we always have to make is that high quality mask works. So that's a KN95 and N95 mask work.
Dr. Ferrer left the door open to imposing a future mandate, but said based on what she's seeing now with declining COVID cases, she does not expect a mandate anytime soon.